All right, everybody. Angela, you ready? Oh, not Angela. Nicole.
Yes, I'm ready.
I know Angela's on. Angela's on. I see that she's on, but
I am
it's
on.
John Elmore. It's 10 o'clock. We're going to go ahead and get started. We may have a few people that are still joining, but we'll just do a couple of introductions real quick and things about this webinar and things to expect and for you to know while this is going on. And then we'll get going. Real quick, certificates, and we'll try to remember to remind everybody at the end too, in case some people are not logging on or not logged on just yet. But certificates will be emailed out to everyone probably by tomorrow. So be looking for that coming from the TTA Center. Alex Elms will be taking care of that. If you are sharing a computer with anybody, make sure you let us know at the TTA Center so you can either just reply to some of the emails of reminders you've had, or just send it to nctta@ncpreventiontta.org. And for this webinar, everyone is muted, so it'll cut down on feedback and background noise and things like that. See, somebody has already found the questions blog or feature box. So if you need to say anything, hey Tamika, how you doing? Good to see you. If you do want to chat or ask a question about anything that's being discussed or talked about throughout this, just use the questions box over on the right side of your screen. So with that being said, we're going to, I think, go ahead and get started. Welcome to this roadmap to credentialing, certified substance abuse prevention consultant. It's a lot of words right there. And so for a lot of times, we're just probably going to use the acronym CSAPC there for you guys. And this is a webinar that we've been wanting to do to try to, several of us have been talking across the state as far as trying to build a little bit of momentum in North Carolina to get more people registered and more people certified within our state. And so hopefully we can start that today and continue that. I know Angela did we had a session at one of our forums conferences a month or so ago, and got a lot of great interest in that right there that day. So hopefully we can start building a little momentum. But for this webinar and its purposes, you see at the bottom of this first screen right here some different logos. As I said, my name is John Elmore. I work with the North Carolina Prevention Training and Technical Assistance Center, and also somebody who helped us with the four of us, myself that I'm getting ready to mention, myself and Anna Godwin with SYNC right there, Community Impact North Carolina, Angela Maxwell with the Prevention Providers Association. Her logo is Prevention is the Answer, and Nicole Augustine with the PTTC. I'll let her introduce herself in just a second, but we have been going through the last couple of months, really going through some phone calls and emails, trying to design a webinar that would at least spike some interest in gaining some momentum towards people being more certified within the state. As far as this webinar today, Angela Maxwell, I don't know, do you want to introduce yourself, Angela, or do you just want us to go on?
You can proceed. You've already introduced me. Thank you.
Well, she's just going to be what we're calling her our chimer today. She's been in this field for a while. She's got a lot of expertise, and so sometimes she'll have some answers to questions that I may not have, and Nicole will as well. And so we've been honored to have Angela taking part in it, give us a lot of feedback as to what some of the routes we should take, and her and Nicole are just great in this field. I've been here for a while. Nicole, I'm gonna let you introduce yourself because we're going to be switching back and forth, Nicole and myself, through slides, a few slides at a time. And so, Nicole.
Sure. So good morning, everyone. As John said, I'm Nicole Augustine, the project coordinator for the Southeast Prevention Technology Transfer Center. I'm excited to be on the webinar this morning and definitely look forward to having a conversation about certification and why we should be prioritizing certification as a field.
Excellent. Thanks, Nicole. And I'll be handing it right back to you after this next slide. And so let me see. Trying to, hold on a second. There we go. All right. Had to fix something here real quick. For our webinar agenda for today, looking at topics we're going to be discussing during this webinar, or goals and objectives, whichever way you want to word it. We're going to start off kind of looking at who is IC&RC, and you're going to see who that is and that they're pretty much the people that this runs through. We'll look at benefits of certification, look at prevention, how it is a profession, and then steps to credentialing. That's the format we're going to go through. And with that being said, we'll pass this on to Nicole for the next few slides.
Okay, great. Thank you, John. So the International Certification and Reciprocity Consortium is IC&RC. So they first got organized in 1981, which, if you think about it in terms of the history of prevention, that's relatively young. But at the same time, old enough to where I would say probably more folks should be credentialed than are. It right now has a network of over 50,000 professionals and includes some major partnerships. So some of the acronyms you see here on the slide, CSAP, which is the Center for Substance Abuse Prevention. They have a fellowship program. There's CADCA, which is the Community Anti-Drug Coalitions of America. There is NPN, which is the National Prevention Network. And then the other major partner is ONDCP, which is our Office on National Drug Control Policy. So IC&RC has done a really good job of positioning themselves, of having some strategic partnerships and providing products that, you know, include the latest research and are built on evidence-based practices.
I'm getting it. If I click off of the screen, then I have to click back on it to do it. So.
Okay, no worries.
I'm good now.
So really, what is the purpose, right? IC&RC developed one standards for all substance abuse providers, not just prevention, but they also developed the examinations, and they've been doing this for a long time. There is, you know, IC&RC is international, as the name says. As you see here, you know, there are 73 member boards. This includes 11 international regions. There's even representation on the Native American regions and in all branches of the U.S. military. So substance abuse prevention and treatment is something that is throughout all aspects of, you know, society, if you will. There are 56 boards that offer specifically the prevention specialist credential, and we've looked here in the top 5 in terms of the, you know, the quantity of prevention specialist credentials that they kind of put out are Ohio, Texas, North Carolina, Michigan, and Oregon. This here is just showing you the listing. I've mentioned that, you know, the credentials are not just for prevention. They're, you know, predominantly is what we experience. The most credentials are on the addiction side, for addiction counselors to clinical supervisors, even certification on the criminal justice side of things. There's a peer recovery credential also, which I'm seeing a mistake there on the slide. Sorry about that. And then the prevention specialist. So if you remember on the first slide, the board itself has existed since 1981, but the prevention specialist credential really didn't start until 1994, which is about 25 years ago. The IC&RC call it PS for prevention specialist. Here in North Carolina, we call it the substance abuse prevention consultant credential, specifically to our state.
Ooh.
So we would like to do a quick poll because one of the challenges is not having enough certified professionals. So we're testing out some new technology here, so give us just a second. We'd like to do a quick poll for the folks who are on the call of whether or not you are certified, are you registered to take the exam, are you registered just in general, or none of these apply to you. So if you could take a quick moment on your screen and click the one that is appropriate for where you are in the field. Okay, we'll give folks a couple minutes to do that. And we're hoping this technology works. You know how these things are. It's supposed to show us what live report of what's happening here amongst the folks on the call.
Can you see that, Nicole?
I don't. The only thing I'm seeing is the actual poll.
Okay, I've got the results right now. Right
Okay,
now we have
great.
89% of people who have voted. So if you have not, get that in real quick, and then I can tell Nicole what all of us what the results are right now.
Awesome.
And that may be where we're going to be at 89%. I would imagine everybody would have voted by now. So with 89% of people, we have 31 attendees. So 89% votes in. 4% of us are certified. That's, well, we're not, as far as panelists, we're not allowed to vote, but
Right.
as far as attendees, 4% are certified, 12% are registered to take the exam, 56% are registered within the system, and 28% none of the above. So.
Okay, yes, yes. So these are very, very interesting results. I would say that this is actually pretty common for our field. And probably if we dug any deeper, it'd be interesting to see of the, I think you said 56 are registered right now with the board. Was that correct?
Well,
yeah, it'd be interesting to see how long folks are registered. But yeah. John did a little digging for us to see what do our stats look like in our state. So this is what we're seeing as of January 2019. We've got 69 folks who are certified. We've got 6 that are registered to take the exam, and then 28 who are just registered in general. And so I know for me, when I look at this number, 69 is actually low for when you think about how many folks in North Carolina are practicing prevention, right? And so these are numbers we want to work on, and that's really kind of the motivation for this webinar today, is how can we get these numbers up to really get people moving towards certification and prioritizing it.
All right, thanks, Nicole. And also I wanted to say about that, the 69 certified, there were a lot of, we actually got the list from the practice board of the state practice board, and there were a lot of names that I did not recognize. It doesn't mean they're not doing prevention, but some people are maybe just double certified and their main priority work may not be prevention. There are also a couple of people I know that are not even in this state anymore who are still registered with this state. And so I know our director for the TTA, Jamie Edwards, he worked in prevention in North Carolina a little over a decade ago, and he left and he came back just a couple of years ago, and he was surprised because the number had dropped so much. He expected it to be higher. So we're really seeing this as something that we want to build some momentum toward, which leads us into what we want to look at next, some of the benefits of the certification for us if we are certified. We've seen that only 4% of us right now on this webinar are. Some of the benefits, though, is it identifies professionals who are specialists in the field. It helps a lot when you're able to go out in your communities, I believe, as far as perception, and people can see that you have taken the time to put the effort in and gain the knowledge in your field so you know what it is you're saying. It establishes credibility and verifies competency. That goes back to what I'm saying too, within our perception in the communities. You become more credible with people, I believe, if you can say that you are certified. It doesn't mean that if you're not certified, obviously, that you don't have as much knowledge, or even more so than somebody else who is certified. I think just sometimes just having those CSAPC letters and being able to call yourself a prevention specialist to people in your communities can maybe help get us in the door in some places a little bit easier. It also provides the benefit of reciprocity. So example for that is if you're moving to another state, and I did mention that I know of one person at least on that list of people who were certified that no longer lives in North Carolina. They live in another state, and it does transfer over to another state. And so that is something that is nice to be able to know that we have here for that option, that it is for reciprocity. And also I believe it can become a marketing tool. I think for each individual, it enhances your reputation in your profession, which I've already mentioned briefly. And also for agencies, I think it helps with promoting your agency to the public, the client, potential clients, and funders. I also think it helps our state. I know I had a chance a couple of months ago to talk to Costella Green, and for people who don't know who she is, she's with SAMHSA, and she was letting me know that she sees a lot of good things really going on in North Carolina, and I think the more people we have certified within our state, they begin to see that we take it serious as being prevention specialists here in this state. Whew. Okay, so what is a profession? I want us to talk about a little bit about what a profession is and then prevention itself. A profession is obviously a full-time occupation, whether it's 40 hours a week or whether you're in you're working more than 40 hours a week. It's someone who's in a full-time occupation, and it's an occupation where you build your skills, you develop your expertise in the field. And so I think we do a pretty good job within this state through different organizations, from Addiction Professionals in North Carolina to the PPA to SYNC now and the TTA, with offering enough trainings and TA with people within our state, with Nicole and them as well now with PTTC, where we can offer plenty of TA and help and throughout our state to where we can build people's skills and develop more expertise within this field in North Carolina. In a profession, it keeps you learning. And especially in our field, we're constantly challenged. I think we all understand that. We're constantly challenged to have to stay up to date with the latest developments. And I look at prevention, I think we all should, as being a proactive profession. And I think sometimes we end up finding ourselves being more reactive than we are proactive. And we're kind of in that state right now with the opioid crisis. All across the nation, we are trying to battle this opioid crisis, and we were reacting to things that have been going on for a while. And while this is going on, we have other issues that are really starting to form, with marijuana taking hold and becoming heavily a social norm, and now vaping, in whichever way people are choosing to vape different products. And I feel like we're going to find ourselves, almost because we're not being up to date sometimes with the latest developments, not saying that we aren't as individuals, but just our communities and some of our leaders maybe not being proactive enough in this field. And so I think if we look at this as a profession, that it keeps us learning to where we have to challenge ourselves. And then finally, a professional solves problems. They do good work, and they're involved in making decisions which help to improve people's lives. And I believe that's really what our role is as prevention specialists, prevention providers across this state, is we want to provide people with and give them the ability to have safer and healthier communities. So what is a profession? Simply put, prevention is a profession. And since prevention is our profession, for many of us who are here working, it's something that we have to be competent in. You know, we have to be measured and we have to be monitored. It's not safe to just assume someone's competent in something. And when you really look at it, a lot of other professions in our society, in our country, especially in this world, are measured and monitored, so why not us? If you look at people in the medical field, psychology, social work, law, when it comes to law enforcement, or lawyers, or educators, teachers, other different professions, they're all measured, and they continue to be measured. They have to pass a test to be able to work in those fields, and they maybe have to continue to be educated and continue to receive hours and continue to be monitored in what it is they're doing each year. And so if we're going to look at this as our profession, I think it's something that we have to understand we need to be measured and monitored. And so we need to look into that. And we're also looking at prevention as a profession in the prevention field, and in a lot of other fields. It's really in our society, we face a lot of different challenges, from crimes to illnesses to substance use and misuse to violence. And so as a preventionist, our role is to use evidence-based prevention practices to take this message to communities. And there are a lot of different practices. I know we do a lot of the SPIF model, and we work a lot within the CSAPC strategies, and we do a lot of education within our schools and communities and workplaces and other organizations. And we're really using these practices to be competent, well-trained, ethical, and professionals within this prevention message, because you all are the ones that make it happen. you bring the success. Whether you are certified right now or not, you're bringing a lot of success to your communities. But this whole webinar, as Nicole has pointed out, is we hope to build some momentum towards people understanding the importance of becoming certified within this field in our state. So prevention is a profession. I think we have to look at it that way. And if we see prevention as a profession, why not take the next step? Why not take the next step to look into being credentialed, to taking the test, to passing the test? I think credentialed staff ensure that programs we're running will deliver on their mission of well-being and safety. I know for me personally, if I was an administrator or working in a school system or within the community and someone comes up to me and they offer this program, and I'd be more willing to allow the person to maybe give us their input or speak to our people or deliver some content if they are considered a specialist in their field. And since we are professional, why not take the next step and get an understanding of prevention in the latest evidence-based practices, says we have qualified professionals. And then finally, the prevention specialist credential requires a professional to be competent in their knowledge, experience, education, and passing of a rigorous exam. We're going to talk a little bit about the exam here near the end of this webinar, but to become a prevention specialist, it's a lot. It takes a lot of time. It takes experience. It takes a lot of education. It takes a lot of effort, and really just someone who is consistent in their work to be able to get to that point where they take the exam. So I want us to remember as we go throughout this today, and that we need to look at prevention more as a profession within our society. And so who are the type of people who should become certified? I think, as it says, anybody who identifies and works with people in high risk categories, and or especially in our situation, a lot of times in alcohol and drug education settings, whether we are educating people or supporting people or empowering individuals, whether we're working with families in school settings or within our jobs, or we're doing things in our communities through coalition work or just community events. But anybody who is working in that type of environment to help people meet life's challenges and transitions are the type of people is someone who I think should really seriously consider becoming certified here in this state of North Carolina.
So thank you, John, for that. I think it definitely sets the stage of this, hopefully this transition, that certification is an expectation, not an option, right? If you think about any time you've ever decided to see a doctor, if you needed a lawyer, if you needed a therapist, one of the things people do is look for whether or not the person is certified. You know, would you allow a surgeon to work on you that didn't actually have an MD behind his name? You know, and the work we do, we should be holding it to the same level and the same standard, and that's really kind of the shift in mindset. So when we talk about the credentialing process, which is what we're going to talk about here for the last portion of the webinar, there are 4 main steps to credentialing. There's a registration process, and then we look at experience, education, and the exam, and we're going to talk about all 4 of these sections. So starting with registration, again, we have 56% of the folks here on the webinar this morning who are registered. So a lot of you are very, very familiar with this process, but it begins with establishing a supervisor. And as a prevention specialist, you're allowed to have a supervisor who is either has clinical supervision, or you can actually have another prevention specialist be your supervisor, but they have to have at least 3 years of experience before they can supervise you. The next thing that's a part of supervision is you need to complete 300 hours of a practicum. This equates to about roughly 2 months of work experience, where your supervision ratio is 1 hour for every 10 hours of work. And then the other thing that you'll need to do with registration, or kind of like piece of information to know, the next click for me, please. is that this is limited to 5 years. So this is one of the things I was saying a little bit earlier. It'd be interesting to see of the folks on the call, how long folks have been registered. This is really just a holding place. I think 5 years is very, very gracious that they give, but there's a limit to it. After 5 years, you would have to reapply and completely restart the registration process. So things that people need in order to get registered. You need documentation of either a high school graduation, GED, baccalaureate, any kind of advanced degree or education. Obviously, you'll need the supervision agreement, which we mentioned earlier. You'll have to agree to the ethical standards and complete at least 3 hours of ethics training. You'll also submit your resume and your job description showing that you're working towards and in the field of prevention. And then there's the money that's associated with it. So there's a $200 registration fee and then a $25 application fee that's a part of this. And then you will need to complete a background check. Again, you think about why all of this is there. The background check is to make sure, right, the folks in prevention are, one, qualified and don't have any sketchiness, if you will. The next thing that you want to think about, and remember, so that registration, all that we talked about, you can be in that space for up to 5 years. The next thing you want to start working on is your experience. Okay. So here, the first thing that's listed is that 300 minimum of your practicum, which you start to get during your registration hours, your registration time. Okay. The next thing, you'll need 3 years of full-time experience, and that is if you're someone who doesn't have any sort of advanced degree. Now, if you're someone who has a bachelor's, a master's, anything else, they do cut off a year, and you can finish the whole process in 2 years, actually, and use your educational background towards that time. And so this talks about the education. During those 2 or 3 years, what do you need to be working towards? There's 270 hours of approved education or training, which this today gives you an hour towards that, so yay. There will be 170 hours needed specifically in the primary prevention area and life skills training. And then 100 of those hours would need to be specific to substance abuse specific materials. And they actually give you a listing of those major categories. They want to make sure we know about HIV/AIDS, any sort of STDs or infection. We also want to make sure that we're competent on the ethics for our field. And then there's a couple other specific categories too that they want to make sure we have competency in. One more click for me. Yep. So so you'll need 6 hours of time in any of these categories. And that is required. I would say a lot of times where folks run into issue is they'll have all of these training hours, but they may forget to get the specific minimums for some of these areas. So you definitely want to make sure that you're paying attention to that as you're looking and seeking training opportunities to help you with your certification.
And Nicole, just to add to that, for the specific trainings, you don't have to get 6 hours of any individual one. You can do combinations. So it can be 3 hours of nicotine dependence plus 3 hours of evidence-based treatment, or in our case, they'll accept evidence-based prevention approach trainings as well. So it doesn't have to be all 6 in nicotine or any of the other categories. It can be a combination.
Exactly, and thank you for clarifying that in case that was confusing. I appreciate that. But yeah, so it's important to have that combination, because sometimes that's where people get caught up. They're right near the end and they're like, oh man, I don't have these specific categories. And again, the purpose of this is so that our training and our expertise and our experience is well-rounded.
All right, so I didn't mean to do that. Sorry, hold on.
No worries. Yes, so this here.
Questions.
Oh, what'd you say?
I was trying to just check and make sure nobody's asking any questions.
Oh, okay. And it pushes
And they're
through.
not.
That's okay.
They're good.
So registration, experience, and education, those are the three main categories of what you're going to be completing in that first either 2 years if you have an advanced degree or 3 years. And once you've done all that, then you get to shift to the next phase, which is the exam that John is going to talk about in more detail.
All right. So this is the last piece that we really have on for this webinar. So it's probably not going to take us a full hour, but we will have a chance for you to ask any questions, and I'll stay on, and maybe Nicole can as well, in case anybody has any questions afterwards.
Yeah, absolutely.
I also didn't mention too earlier, but this is a recorded webinar, and the slides will be available for you. So at the end, remember, we'll let you know what you need to do about that. But as far as the exam, which Nicole mentioned, yes, you have all those things. You have a lot of work leading up before you can even take the exam, as far as your time that must be spent in the field, getting someone to supervise you, the hours you have to receive from trainings and different type of things like that. But then it comes to the point of the exam. And each candidate will receive correspondence from the testing company regarding specific instructions to register for this exam. So they stay in contact with you. It's easy to be in contact with them. They just reach out to them, and they are pretty quick to respond with that. But as far as the exam itself, it's 150 questions. It's multiple choice format, 4 options. So this is not the type of test where you're going to have to go in and have a short answer or any essays, anything like that. It's no matter what the question is, you've at least got a chance of being able to narrow it down, marking off the answers that you know are not correct and narrowing it down if you're not sure of the answer. So it'll be multiple choice. It helps you with that. But I know when I took it, a lot of the questions were sometimes choose the best answer. And so some of them were questions where 2 of the answers would have seemed like good fits, and you just had to pick the one that was really the best response for that. And so remember that it is 150 questions, multiple choice. It's computer based. It's offered on demand basis year round. So basically what that's saying is that once you've got all of your certificates uploaded in and turned in, and you've been approved, and you've had your supervision already, and you're ready to take the exam, you get to choose where and when you want to take the test. It's offered at different locations across the state. So you can choose when and where you want to take it, which is nice to have. And also, once you take the exam, your preliminary scores are going to be available as soon as you finish the exam. Before you leave the location, you can get your results from your exam, whether you've passed the test or not. The official scores, as it says there, they're going to come later on. They'll follow with that and send that to you later of your certification from the credentialing authority after your exam date. But you know that when you leave there, you're going to know whether you have passed or not when you take the exam. The exam, as I said, is 150 questions, and you have 3 hours to take the exam. So you have plenty of time. You don't have to feel rushed. With it being a computer-based one, I remember when I took it on the computer that you were able to, if you didn't know about some questions, you could click on a number to the right so you could remind yourself later to go back and check out that question again. You have plenty of time. Don't feel like you're going to need to be rushed to get through this. Continuing on with the exam, of the 150 questions, only 125 of those questions actually count towards your final score. 25 of those questions they consider to be unweighted. They also call those pre-test items. And as you're going to see just below this, pre-test items allow the exam to stay current with the profession in a constantly evolving profession. We know that we have a profession that's consistently evolving. It's parts of it change. We're still doing a lot of the activities that, the SPIF model and the CSAP strategy, they've been around for a while, and we're still doing those, but we also know that is a profession that is evolving. The pre-test items also allow IC&RC to produce more test forms, so they increase the security of the examinations. So you may take the test one time, you may not pass it. You may go take it again, and it's going to be a little bit different than it was the first time, most likely. So everybody is not receiving the exact same test. They're pretty similar, but they're not the same. Also, pre-testing items is the best interest of candidates as it helps to ensure the quality of future examinations. A few more things about the exam. When you go, after you've registered and you've picked your site and your location, your time to take your exam, there are no books, papers, or any other reference materials are allowed in the exam room. Obviously, they're not going to allow cell phones in there as well either. So make sure you just leave that stuff in the car before you go in, and that's pretty much self-explanatory as to why those things are not allowed to be taken in with you. There are no questions concerning the content may be asked during your exam period. So you're pretty much on your own. There may be other people in your room. I don't know how each site is set up. Mine was set up in a cubicle form, and they were just around the four walls of the room. And so there were some other people in there, but you didn't really see each other. So you had your back to each other, or you had the cubicle blocking you from seeing other people. But it's not going to be an option where you can just raise your hand, somebody comes in and you ask questions. It's similar to the end of grade tests at school. When a student asks a teacher about a question, the teacher can only say, just do your best. I can't help you. So you're kind of on your own there. There's no chance to ask questions. You'll need a form of ID, some photo identification on the day that you take the exam, obviously to make sure that the person who is taking the test is the one who should be there. Remember this, if you arrive late, you'll not be allowed to enter. You're going to forfeit your opportunity to test on that day. So make sure that you schedule your time to where you're going to be there early. Plan for if there's any accidents or traffic, things like that, to make sure that you don't show up late, because if you are late, you will not be allowed to take the test. Finally, candidates who do not pass the exam, you can retest it after a 90-day wait period from the date of the exam, your last exam, the one you just took. So don't feel down and out about it. We'll talk about the pass rate here in a couple of minutes, but if you fail the test, it's okay. You can take it again within 90 days. Scoring for the exam. Scored on a scale of 200 to 800. To pass the exam, you have to achieve a score of at least 500, and it's determined by the number of questions that are answered correctly. And the scores are broken down by categories known as the domains down there, which you need to really study before this test. So this allows you to see the percentage of correctly answered items in each domain, they will. And you'll get a report on that after your test on how you performed in each one of the domains. But the domains tested by the way to the exam, planning and evaluation is the biggest one as far as the percentage on the test. 30% of the test will have to do with planning and evaluation. 15% of it will be prevention, education, and service delivery. So I think with the shift in the state and the way we do prevention now, we were doing so much prevention until 2 or 3 years ago, and I think that made it more difficult for people to pass the test, because they were doing majority of their time in a classroom setting doing education, and that was only 15% of the test that they were taking. 13% of it is on communication, 15% is on community organization, 12% on public policy and environmental change, 15% on professional growth and responsibility. And I really think that if we can just get the interest and people excited enough to go take the test, that we're in a better position right now as a state with the type of services and interventions that we've been offering throughout our state over the last 2-3 years, to where people would have a better opportunity to be able to pass, just because they're more familiar with some of these domains right here now.
Mm-hmm. Oh, and John, I was just going to say, add a comment to that. I usually encourage folks, so in the event you are someone who finds yourself who takes the exam the first time and didn't pass, one of the things that John mentioned is you will get a report that will show you kind of like how you perform based on those domains. I always encourage people, take a minute right then, even if it's in the car, have a notepad right there, and just begin to kind of think about what were the areas or what were the types of content questions that you struggled on. Because you remember, you're going to have to wait 90 days before you can retest, and you really want to use that 3-month time constructively to focus your, new educational plan and new study plan to really have you at a place where you're performing higher in specific areas. And what I've learned is if you don't do it immediately, you forget it. because it's a lot of content, a lot of information. You want to make sure that if you do, unfortunately, don't pass, that you have a space and opportunity to understand what content you need to focus on, so that when you do retake, you can pass it.
Exactly. Thank you. And also, like she's saying, it's good to, as soon as you take it, jot down some notes about what parts you were struggling or seeing more difficult. And you had the 90 days. And I would really encourage someone to try to take it as soon after that 90 days as possible, because a lot of that stuff's still going to be fresh with you. You've already studied, you've seen what you struggled with a little bit based on your report. And so you know what you need to focus on a little bit more. If you wait a year or two down the road, then you're having to restudy the things that you've already been studying for the past several months. So I would encourage you, if you do take it and not pass, to not get down, but then just to figure out, these are what I struggled with, start working on it, and take it as soon as you can after the 90 days would be my suggestion. So anything else?
No, that is absolutely truth advice. I've met folks who waited too long, and the first thing they said is, "Oh my God, I have to start all the way over with my studying." You know, versus just honing your studying just a little bit, and it can be discouraging.
And we'll be honest, it's a lot of studying that goes into it, because it's not like you have a list of this is what you need to study exactly, this is what's going to be on the test. I mean, as we pointed out earlier, there are different tests, so you see what the domains are going to be, and so you can study things in general, but it is a lot. So just remember that as you are going through there, how it's scored, and that you will get a report on how you're doing. And even if you pass the test, you're still going to get that report, and you can still see what you're struggling with. And I would encourage you still, if you've seen that this is what you struggle with more, then that's maybe what you should probably go home and try to learn some more, just to help yourself in the field in general when you're going out and doing your job on a daily basis. All right, once you pass the exam, and you will pass, as we're getting ready to close here soon, you want to celebrate. Remember, it's not a simple test. In 2017, the pass rate was 67% for all candidates that took the test. And that's not just North Carolina, that's everywhere that it was taken. So, 2 out of 3 people were passing. So 1 out of every 3 was not. So it's not a guarantee that people will pass it. Obviously, the people who have been working in the field, especially the way we are doing work now in North Carolina, we have a much better chance, I think, of passing it because of the style of work that we are doing right now, and not just performing education only within the classroom setting. So just remember, it is not a simple test, but once you pass, celebrate. I'm not saying go out and have a weekend like a bachelorette party or a bachelor weekend party, but celebrate, have a good time, be proud, let people know that you've passed it. Send us a message and let us know that you've taken it and you've passed it. And I don't know, maybe we could start reporting that out when people pass this stuff, so that people know who specialists are in the field. We've got plenty of resources here with good emailing list between the TTA and SYNC and other PPA, that we could get that information out, and so people can know who's certified in their area, that they can tell people to reach out to if necessary. So it'd be nice to be able to congratulate people in public in some ways too, whenever they do that, whenever they do take the test and pass it. Once you pass the exam, keep up to date with the latest trends and trainings. And the reason that you're going to need to do that, obviously we need to do it for our field because it's constantly changing anyway. But the reason you do that is your certification is good for 2 years. Then you have to renew or recertify, whichever way you want to word it. Now, we had to have 270 hours for certification to be able to take the test. Once you pass it, every 2 years, you need 60 clock hours of training. And within that 60 hours, it includes 3 hours of ethics, also 3 hours of the HIV, AIDS, STD, or BVP, and also 3 hours of the special topics. And it's set up the same way as what we were talking about earlier. You can have 3 hours combined of nicotine dependent, substance abuse veterans, all those listed down there below. It doesn't need to be 3 hours in each one of those, but you do need to have 3 hours of ethics and HIV, AIDS, blah, blah, and 3 hours of those special topics. That's included in your 60 hours. And I believe that with, 60 hours sounds like a lot of training, and it is. it's a lot of time that we have to go. But with the conferences and the forums that we have in North Carolina, and what we offer here with the TTA, and maybe what SYNC will be offering, and trainings through the AP&C and that the PPA are involved with, we give people enough opportunity to get most of those hours here within this state. For the TTA itself, I know we generally offer 1.5 to 2 hours, if not 3 hours. I think we did 3 hours of ethics this year in one webinar. We try to offer those ethics and HIV and something along nicotine dependence, and maybe something with veterans each year, so that we can help people towards their certification and recertification as they're going on through that. And as we get ready to finish up here, some tips for the exam. This is from IC&RC. Don't overthink the questions, and don't change your answer unless you know you're absolutely sure it's wrong. So if you put an answer down, unless you later realize, oh, I was wrong, and you go back, just keep it, don't overthink it. And as I said earlier, you will have access to these slides. They'll be on our website as well. So if you need any help finding them, let us know, so that you can at least make sure you have this information right here too as well. There is a free 96-page study guide from Rhode Island that can be found at this address, and that web address right there, internationalcredentialing.org/exam prep. Also, there is a practice exam that can be taken for $49 at this link at the bottom. And I believe that you can only take it one time for that $49. I'm not sure, you may be able to pay again and retake it, but it's not a pay one time and continue to take the same test over and over. But it's just something maybe that if you were interested in doing that, I would do it maybe later in the process, so that you know where you're at. Not too late, but I wouldn't do it too early, because you may just waste your $49 unless you're wanting to see kind of where you stand. But there's just a couple of different options there that you have for the exam, as far as study guides and a practice exam that can be taken. Statewide resources, we're here to help you guys. I think Amanda is, or not Amanda, I think Anna from SYNC Community Impact North Carolina is on the call, but she may be muted. But I believe she's on the call. Be sure to reach out to them. They do a lot of work in the state with coalitions and things. Angela has been on this call from the PPA as well. We do have a question. I'm trying to see if I can figure out how to read it. Here we go. Somebody had asked recommended study materials, resources, where to access. I think that was maybe before that I gave those couple of things. If there are other ones that you need, maybe reach out to us. I think Tansy Walls had asked that, and Karen Medina had also kind of asked the same thing, any specific places. Angela, Nicole, do you guys have any other areas or any other places where you think people could benefit with study materials and resources?
I would say that the Rhode Island study guide is going to have a list of resources at the back, but also on the IC&RC website, internationalcredentialing.org website, under their prevention specialist section, they'll have a candidate guide. In there, there's a listing of resources as well. And so many of those resources are available for free online, like the CADCA primers is a part of that. And so once you look at the back of those guides, they'll link you to available free resources. So definitely look at those guides for that information.
And then the only other resource I can think about that was really, really helpful for me, there's a textbook called Substance Abuse Prevention, the Intersection of Science and Practice. So I'll say it again, it's Substance Abuse Prevention, the Intersection of Science and Practice. And I personally read that book cover to cover, and I mean, it was the best thing I could have read in terms of a one-stop shop for content that really helped to prepare me for the exam, in addition to, you know, the stuff from CADCA, the stuff from SAMHSA. But I definitely recommend that folks at least, and if you're with a prevention agency, I think it should be a book that every agency has. I know, Angela, you, for instance, have several copies, right, that you provide.
I do. I do have that, and thank you for reminding me of that textbook, because it is excellent. I just had a staff person who take the exam back in March, and she passed, and she said that the greatest study tool that she used was that textbook.
I tell everybody the same thing.
Yeah, so if you have, like you said, if you're in a prevention organization, or if you're in an organization that's willing to purchase it for you, they're definitely a great resource to have, even beyond the test.
Mm-hmm. Mm-hmm.
I know some people have also used the CADCA primers. There's some good different resources out there. We've listed a few today, and if you need more, reach out to us. We have a couple other questions, Angela and Nicole, that you might be able to help out with. Tamika, we'll get with yours right now, and then Basil, we'll get yours, so just hold on for a second. Tamika was asking, she said, if I have previous experience in a substance abuse setting as a qualified professional, could I use any of that time toward this process?
Yes.
Yes.
I thought so.
And so your whoever your supervisor is, who's supervising you through the prevention certification process, as long as they're willing to sign off on the hours, then you can use those as well. You can also use previous training hours as far back as the days are long. And so as long as you have 60 hours completed within the past 2 years, then you can use training hours back to 1975 if you have those still on hand.
Nice.
Yeah, the short answer is yes.
Nice to know.
It definitely yes.
It's a good answer.
Yeah, I was going to say, the board, their goal is to get more people certified. I know people, who came in and got it done in a year because they used their previous work experience. They had documentation of it, so the whole purpose is to have more people certified. If you have previous experience, absolutely leverage that. It's going to actually push you through the process much, much faster.
Absolutely.
Great. Also another one, someone's registration expired. Will all previously completed supervision hours transfer to new applications smoothly? I think it's pretty similar answer to the last one, right?
Yes, it is. You just have to make sure that the person redo the supervision documentation, but it does still count.
Let's see. Another one is the text by Jill Hogan.
Yes, it is.
Okay.
It's Julia Hogan, actually.
Julia. Okay.
Yeah, Julia Hogan.
Yes, and Amazon is running it now for about $52.
Which is a great price, actually.
It is.
Okay. Any other questions anybody has? Always, even if you think of something afterwards, feel free to reach out to any of us. I know if you reach out to me and I don't know the answers, I know I'm going to probably go straight to Nicole and Angela. They're real familiar with the way this system's set up and have been for a while, and so they're great resources to reach out to. So, any other questions, comments? Okay, so Nicole, Angela, do you guys have anything else you would like to just add?
No additions for me.
Okay.
Yeah, none for me also. Just encouraging folks to reach out to the resources across the state and to get certified.
Yep. Well, thank you, Nicole and Angela, for your input. It's always great. Hopefully we'll see this number jump up a little bit over the next year and following years from 69 and get it back up to where it used to be here in North Carolina. And thank you all for attending this webinar. As I said, the certificates, I said this earlier, some people have registered, have logged in since we started. Certificates will be emailed probably tomorrow. If you are sharing with anybody, let us know at nctta@ncpreventiontta.org. And we'll make sure that you get your full credit for this webinar. With that being said, I think we are concluding this webinar unless anybody else has anything they want to add. Doesn't look like it. So have a great day and thank you for attending.